Welcome back, everyone. Thanks again to our incredible keynote speaker, Dr. Manny Jimenez, and Dr. Leora McGillner for a wonderful opening to our time together today. It's now my pleasure to welcome Councilmember Jennifer Gutierrez for some remarks. Councilmember Gutierrez is a lifelong advocate for working class and immigrant communities with more than a decade of service in District 34. Her commitment to public service is deeply rooted in a lived experience and community organizing. Since being elected to the New York City Council in 2021, she has really built a strong legislative record focused on maternal health, childcare, housing stability, technology, and equity. Today, she is the chair of the subcommittee on early childhood education and is leading efforts to expand access to affordable, high-quality childcare for families across New York City. She is also an extremely strong supporter of early literacy and a champion for our city's first readers network, helping us advocate for policies and partnerships that really support young children and families. So we are very honored to have her with us today. Please join me in welcoming Councilmember Gutierrez.
Good morning. Thank you so much. Can you hear me okay?
We can, thank
Yes.
you.
Okay. That was quite the introduction. Thank you so much. And thank you so much for inviting me and including me in part of this conference today. I think it's such a beautiful marriage of the things that I personally am so passionate about, one of which is science backing medicine. And so I just want to personally thank you on behalf of my entire community. We appreciate and value the work that you all do. I also, with the privilege of, yes, being a council member, I was elected back in 2021, right around the same time that I was pregnant with my first child. And so it has been an incredible journey for the last 4.5 years to represent my community, which is parts of Bushwick, Williamsburg, and Ridgewood in Queens. And 2 children and kind of navigate, yes, being a working mom, but also taking my experience um, to help me better understand how to create policy that is going to be helpful for working families like myself. It gives me a really good sense of what people are feeling on the ground, and that's why supporting early literacy and being champion for early childhood education has been very much my priority and my focus, and I hope like my lifelong purpose, but it has been double rewarding. And so thank you all for having me. Um, and like I said, I'm so grateful to be with so many healthcare professionals and educators who understand that supporting children and families, especially now, requires care that goes beyond the walls of a medical institution or classroom. I am the daughter of Colombian immigrants. Spanish was my first language, and I was very fortunate to be able to learn 2 language. It was not my choice, obviously. It was sort of what was necessary at home. But I remember a time when both my parents, um, had barriers to their level of participation or the way that they engaged with my sister and I when it came to school because they didn't speak Spanish. And this was a time when speaking another language was not celebrated. We did not have, I think, the data that we have now that demonstrate how beneficial it is to be able to expose our children to multiple languages, especially our native languages. And so when I think now about my own kids and the way that my husband and I are thinking about exposing them to words and literacy in both languages, that really has been because of the education that I have received and working with so many of our partners under City's First Readers has really given me an opportunity to understand the value of literacy and words and exposure, and even just the idea of having books be physically around their home, letting them touch and feel the books. All these things that I think parents, just weren't equipped with, didn't have access to. We are so lucky to have now. I think really made me feel empowered as a first time mom because I knew at least that much, right? I knew that exposure to books as early as possible in the languages that we speak was going to be beneficial. That there was no waste in time or effort by reading to them for just a few minutes every single night. And through the City Council Cities First Readers initiative, I got to really work with some of these partners, mm, learn how they were working this program in their districts, in the areas that they called home. And part of the reason why I love the initiative so much and I care so much about literacy is because the results are real. The data is real. The numbers are real that demonstrate the involvement, the level of involvement that parents can provide and feel comfortable doing because we're asking them just to expose them to books, which feels like, a very um, accessible task. We're asking them to do it in their language and we're asking them to do it often. We're equipping them with the tools to do this in their homes. And the numbers that we have seen have grown exponentially. The initiative is about 10 years old, but we've been able to see the impact, not just the way that we organize in communities and the ways that we organize around early childhood education providers, but families feel a part of this process that I feel like I mentioned before, for many reasons and for very obvious barriers, families just didn't have that level of access and interaction with their providers or educators or with their children, especially if they didn't necessarily speak English at home. And so working with every single partner in Cities First Readers helped me so much. I actually had walked in to one of the partners programs at the hospital where my first daughter saw her pediatrician, and I absolutely loved it. I absolutely loved it. I came home with tools and books, and my daughter, I think, was 3 months at the time, and she loves to read. She's 4 years old. She loves to be read to. She loves telling stories. She communicates so well. I hear positive feedback from her teacher all the time. And as a daughter of Colombian immigrants who spoke Spanish, who only spoke Spanish at home, to be able to engage with my daughter in both languages and to have her tell me, I want to go to the library, can you read this to me, has been really rewarding, and I think demonstrates how effective these partnerships work. Being able to tie in um, the importance of literacy at your child's check-ins is valuable. I think the information that we take home from our trusted pediatricians, our trusted medical professionals, stays with us. It absolutely stays with us forever. And so being able for myself to experience this as any other constituent would Hall, for example, in my case, um, we replicated it with our younger daughter and it stays with us and it's so valuable. And now as the council's chair of the subcommittee on early childhood education, which is a brand new subcommittee, I've continued to advocate for these investments in these early childhood programs, childcare access, and literacy initiatives because, like I said, we know that those earliest years of a child's life shape everything that follows. It's the difference between a child feeling excited about learning how to read, the difference between seeing the excitement when a child is learning how to sound things out, walking down the street on the way to school, being able to read a sign. It's that level of joy and excitement that I feel we at the council and city government should be doing more of, supporting more of, and working with you all as professionals who can show us why this works and why this is beneficial. That I love to do. And through partnerships, like I mentioned, cities, readers, and organizations like Reach Out and Read, Greater New York, we have the opportunity to meet these families where they are, right in their communities, right where they see their doctors or their pediatricians, and build systems that support the whole child. I also want to say that I really appreciate this conference's focus on supporting immigrant families and creating welcoming, resource connected clinics. As a daughter of immigrants, as a daughter who often interpreted for their parents, I can't tell you the amount of times that my parents really felt discouraged from ending something, taking a job, going to a meeting because of the language barrier. And I think that what this model does is say, welcome. What this model does, it says there's no reason for you to be turned away. We are going to communicate to you in the language that you prefer and the way that we prefer. We're going to be able to equip you with books that are meaningful to you and your family. And that's how we're going to support communities. We're going to meet you where you are. We're going to make sure that we are inclusive, and that we're really centering the needs of those families. And families should never feel isolated from the resources that I want to just thank you all again for your leadership and the work that you do as a mom and as a council member. It really is invaluable, especially especially in these times when we have families that are just so much more vulnerable for unfathomable reasons. When we're able to really spend our energy focusing on empowering and funding programs like this, it really helps to restore a sense of community. When we feel like we're under threat, when we're able to really come together and celebrate something positive and celebrate results, it reminds me of why I do this job, and it really helps bring some light in otherwise dark periods. So thank you all so much for having me, and thank you all for the work that you do.
Thank you so
Muchas
much.
gracias. Just in case I needed to say something in Espanol.
Oh, wonderful. Thank you so much. I think your comments hit on every aspect of what we're, again, really hoping to bring with this conference. So thank you so much. And thank you for your leadership, support. Cities First Readers has been fantastic partnership for us. And we have some members from Link who are joining our later panel as well, connections through our Cities First Readers partners. So thank you for everything that you do in the council to help bring us
Thank
together.
you. Can I say one tiny plug, which is everyone here, if you are a resident of New York and you've not reached out to your council members, please do before budget and say that, you'd love to see this council do more and increase the funding for cities first readers. That would be a great help to me.
Yay.
So please look up who your council member is, call them, email them, and say you want to see them fight for more money for this initiative. Thank you so much, Carrie.
Oh, an excellent plug. And
Yeah.
yes, letters, phone numbers, and we also will have a one-click sign-on for to be able to send emails out there. So that will be coming. How
Excellent. Thank
exciting.
you again. Have a great Friday, everyone. Thank you.
Thank you. All right. We will move this along then and jump to our first panel, and I will pass it over to Shrija Goganini, who will be introducing it.
Hi, everyone. And thank you again, Councilmember Jennifer Gutierrez, for your remarks and your continued support of children and families across New York City. We would also like to thank our incredible keynote speaker again for helping us ground in the importance of early literacy, relational health, and the powerful role pediatric providers play in supporting children and families. With that, we are excited to transition into our first panel, clinics as community hubs, building connection beyond care. Pediatric clinics are much more than places for checkups. For many families, they are trusted spaces where caregivers seek guidance, reassurance, and connection. Clinics can also serve as important bridges to literacy resources, behavioral health supports, and community-based services that help strengthen child and family well-being. Today's panel will explore what it looks like to embed Reach Out and Read within a broader, holistic model of care. Our panelists will share practical examples of how clinics and interdisciplinary teams can build partnerships, strengthen referral pathways, and create welcoming systems of support that extend beyond the exam room walls. We hope attendees leave with actionable ideas they can adapt within their own settings, regardless of clinic size or structure. With that, is now my great pleasure to welcome our moderator, Dr. Liz Isakson, along with our panelists, Dr. Amanda Esteves, Dr. Caitlin Canfield, and Dr. Marcy Stein-Albert.
Wonderful. Good morning, everyone. Thank you so much for that introduction. And I'm so happy to be here this morning and hear the wonderful words from the keynote from Councilmember Gutierrez. I really think actually what she was talking about at the end about community and supporting families really enters nicely into the conversation that we're going to have today. To sort of set the stage, I'm going to tell a little story. When we hear the word community hub, it's kind of industrial. I don't know. When I hear the word hub, I think industrial. And what we're doing here is not industrial. What we're doing here is building relationships and building community. And so I'd like to tell you a little story about an American art form. Trust me, bear with me. And it starts with something. Yeah, go ahead and share the slides. Yeah. So quilts. They're really an American art form. And this isn't necessarily a scene that you'd see in New York City. Maybe our friends from other parts of the country might be more used to seeing this rural setting with a quilt that's kind of randomly patched together with obviously, leftover materials and hang out to dry on a fence. But you can find this in New York City because you can find quilts no matter where you are. Next slide. And if you walk into the American Museum of Folk Art on the Upper West Side, you're going to see quilts, displayed as absolute artwork. And if you go over the east side to Sotheby's, you might see some of these quilts being auctioned off for millions of dollars, right? And I think I want to talk about that because what we're building and when we talk to Dr. Esteves and Dr. Canfield and Dr. Stein-Albert is that they're really building quilts within their health setting and across their communities. Next slide. And I'm going to age myself a little bit, but I'm wondering if anyone remembers what this is. You can put it in the chat if you want. But of course, this is the AIDS quilt, right? In a moment of immense public health crisis in our country, what did people do? Each family put together a quilt honoring their loved one. And it went around the country. Here I am I can say this in New York, I'm getting verklempt a little bit here. So let's go to the next slide. And they really do have an incredible history. So this is a quotation from Henry Bellows, the U.S. Sanitary Commissioner. He talked about Union soldiers did not have army quilts. Each family had to send the blanket with their child. So he talked of the many patches, each of its own color or stuff, which were tacked and basted, then sewed and stitched by women's hands, wet often with women's tears, and woven with women's prayers. By the time of the end of the Civil War, there was estimated 250,000 quilts had been made for Union soldiers. And there's a lot of them don't survive because they were quickly made and actually soldiers were buried in them. It was what they were wrapped in when they needed a fast burial. After World War II, when Europe had nothing, all of their factories and everything had been blown up, thousands of quilts were sent from different communities across the United States where women had got together and made quilts and sent them overseas. And antique baby quilts show us that women invested time, effort, and care in preparing for a baby, despite what we knew was, an incredibly high infant mortality rate, sometimes as high as 50%. And what's really unique about quilts is that they are unique. Even when they were made in the prairie or the deep south, what they call crazy quilts, under the harshest conditions, they show art, creativity, and style. And so here's this thing that's family and community focused, right? Yet can have national implications and impact. And I think what we're going to talk about today, this work that Amanda and Caitlin and Marcy are doing, and all of you are actually doing across New York and across this country, is really building our own quilts, supporting our families, and wrapping them in warmth, which allows them to thrive. So I'm going to take that as our setting. So we're no longer talking about hubs. We're talking about quilt building. We're talking about stitching together things to make the lives of our families and our babies stronger and better. Okay, so with that, I'm going to move on. And we're going to take a moment and let each panelist introduce themselves because they can do a much better job of it than I can. And they're going to give who they are, thanks for stop sharing, who they are, where they're from, and sort of what unique is about their work that they're going to start sharing with us today. So let's start with Dr. Caitlin Canfield.
Hi, good morning, everyone. I'm Caitlin Canfield, as Liz mentioned, and I am an assistant professor and researcher at NYU Grossman School of Medicine, and I have done a lot of research and evaluation with Reach Out and Read and Play Read BIP and the City's First Readers Coalition. And I especially, today I'm going to talk about City's First Readers and other coalitions like this, where we're really bringing healthcare and the community together.
Fantastic, fantastic. Dr. Amanda Esteves.
Hello, everyone. I'm Amanda Esteves. I'm a pediatrician at New York Presbyterian Columbia, where I serve as the clinical lead of our pediatric programming within the Maternal and Childhood Integrated Mental Health Collaborative that I'll speak about in a little bit. I just have to share a little anecdote that our institution is doing their Alumni Day today, and the honored alum was Mary McCord, who was honored at our Greater New York last year. And she shared the anecdote that Reach Out and Read and bringing Reach Out and Read to our institution was the birth of community pediatrics. So our network of pediatricians all on this call are very much interconnected, and it's a pleasure to represent the many folks who do this work.
That's amazing. Thanks for that connection, Amanda. And lastly, Dr. Marcy Stein-Albert.
Hi, good morning. I'm Dr. Marcy Stein-Albert. I'm the Associate Professor of Pediatrics at the Icahn School of Medicine at Mount Sinai and Chief of Pediatrics at New York City Health and Hospitals, Queens, and also one of the folks who worked with Mary McCord. I think that's the thread that has all four of us connected. The 6 degrees of Mary McCord, right? We're proud at Queens to have had Reach Out and Read for 20 years, since 2006. And recently we're one of the selected sites for the Building Connections Begins at Birth, BCBB initiative, to formally expand ROR to include birth through 5 months. At Queens, as you'll hear later, ROR is really part of a suite of integrated evidence-based services in pediatric primary care, which includes behavioral health, and has helped establish a foundation to add many other integrated services to our practice. So I'm excited to talk about that.
Yeah, wonderful. It is a pleasure having the three of you here. And Mary McCord up at 168th Street, her ears must be ringing since we're talking about her. I wanted to start our panel conversation here, kind of grounding us a little bit back in, the true Reach Out and Read moment. And we heard a lot about that this morning from our keynote, but I think it helps to ground us here. And we're really here today because of Reach Out Read. I'm wondering if Amanda, you might talk a little bit in your interactions with families at that family level as a pediatrician. How do book moments, those magical moments that happen with a Reach Out and Read book, uncover and build relationships and uncover family needs?
Absolutely. I think it's just wonderful in so many ways. I think as we move forward and learn more and more and try to build more and more into what we cover in a well-care visit, that can sometimes feel like a checklist or asking lots and lots of questions of families. That book moment is just a time to pause and observe, right? That it's so rare that we get a chance to just sit and watch what it is that the parent and child are doing together. And that moment of observation really is critical in uncovering a lot, right? If their hands are full of things and can't physically take the book from you, if they have that joyful moment and you can give that reinforcement, or if there's just complete disconnect, it's that chance to kind of stop and say, what's happening here and what's driving the way this interaction is happening.
Fantastic, fantastic. Caitlin, I'm wondering if you can build on that and give us a little bit of the science of what's going on in those magical moments.
Yes, for sure. So, from the research, we have decades of evidence, and from Reach Out and Read itself, of course, that early literacy is linked to lifelong health, not just later literacy or academic achievement, but even physical and mental health. And I think there are, obviously, right, there's lots of ways that this happens, but I think there's two that are really important. So first is the obvious one, right, the actual literacy itself. And we've all been hearing about the science of reading, right? And so the science of reading is really like all of the evidence of what we know of what are the best ways to teach children to read coming together. And this includes teaching phonics and encouraging fluency, so being able to read smoothly, teaching vocabulary, and focusing on reading comprehension. And really all of these are part of shared reading interactions, right? Shared reading is one of the best ways to sort of teach all four of these factors. And then the other side of this is the encouragement of relational health between parents and children. So, we have research that shows that early reading interactions reduces parenting stress later on. And so that makes it easier then for parents to be that safe, nurturing influence for children. And so I think that when these things are brought up, in anticipatory guidance or in the observations, as Amanda was saying, it can uncover concerns and knowledge gaps and really, help us understand where sort of the science and what families know doesn't meet. And it also provides a jumping off point for those further conversations. And so I think that, that's where we can sort of bring the science together for families.
Fantastic, fantastic. Thanks for that. And Marcy, I'm going to turn to you next, and I'm wondering if we can share that slide, the slide again. You alluded to in your introduction this amazing process where you started Reach Out and Read back in 2006 and have really built a comprehensive uh, suite of evidence-based programs that are there. And I'm wondering if you can share with us a little bit of how Reach Out and Read allowed you to do that, how that was the gateway to support these other things, and sort of how it happened.
Sure. So working in a city hospital, you learn rather quickly that you have to assess your resources and sort of optimize what you have. And whenever there are opportunities, if possible, you grab them. And so this was sort of one of those times where Reach Out and Read was sort of made available to potentially, bring on board. So we applied, we got it, found space to store books, did sort of all the nuts and bolts of establishing the program. And through that process and some other small programs that created here at Queens, kind of learned how to, again, optimize the use of the limited resources we had. Reach Out and Read is a wonderful program. And it took a number of years for sort of me to reassess some other resources we had, but again, went into the kind of the thought process here. And that was, we had two pediatric psychologists on board in our department who were really entrenched in EI services. We were actually an EI hub at one point. And for those of you who were ever EI hubs, you know that sometime between 2015 and 2018, the bureaucracy part of it became overwhelming. They switched to an online system. I'm not going to go into all the details, but our psychologists were spending way more time with sort of paperwork than actually delivering services to kids. So I decided we needed to pivot. And I had a colleague, actually, one of them was Mary McCord, who was doing Healthy Steps at Gouverneur. And I asked her, what does it take to be, to deliver Healthy Steps? I have the providers. And from that, I contacted the folks at Monty, and we kind of negotiated on a training fee. I convinced our administration to pay for it. Again, I'm going through like some of the gory details, but that's really sometimes what it takes. And we started Healthy Steps in 2018. Same thing, but I made basically conversations with the New York City Department of Health. They had a grant to start centering in 2019. We started centering. And again, each one of these experiences and building additional programs into our primary care services kind of gave me more information on how to do the next thing. In 2020, again, I'll bring up Mary McCord again. We applied for the 3-2-1 Impact Program, which was piloted at at 3 New York City Health and Hospital sites. We were one of them. We were selected, and through that process, we were able to bring Play Read VIP on board here, which was, again, another wonderfully rewarding program, which, for those of you who are unaware, was built by Dr. Mendelsohn at NYU on the foundation of Reach Out and Read. Other programs that I'd been pitching for a long time, my husband was a public health dentist, and who also, by the way, knew Mary McCord at Columbia. So preventive dentistry was my passion. And we finally were able to get a hygienist integrated into our pediatric primary care clinic. And we do preventive services right within our pediatric primary care clinic. And I'll just move right up to 2026. Through all of this, we've been able to sort of do proof of concept that we are competent and mature integrated program. And so when the Team Up team was looking to make their first foray into New York City, our site came up as a site that would be potentially one that could pull this off. And so we're really excited to be starting Team Up sometime in the next few months. kicking it off in June, all the planning phase, and in the fall, we should be up and running. So really, Reach Out and Read, kind of created this foundation that we continue to build on. And it's really, it's kind of the anchor of all of these services in our pediatric primary care space.
Thank you so much, Marcy, for sharing that story. I think it can really serve as an inspiration for people who are, tuning in today. Maybe they have one, maybe they have two of these programs, but your success in one built success in the next, right? You just kept the ball rolling. And if you think about it, if you complete one square of your quilt, you can always add a second one, right? I'm going to kill that analogy. You're going to be so sick of it by the end of this talk, but I really think you did a great job demonstrating that. I want to turn back to Caitlin and I'm wondering, we actually heard from Councilmember Gutierrez and her plug for City First Readers, and I'm going to re-emphasize that plug for our participants that are New York City residents. And I'm wondering if you can share with us sort of like Marcy did that within the Health and Hospital Queens, right? And City First Readers, how's that doing with literacy across sort of programs outside of the clinic walls?
Yeah, absolutely. Yeah, so Cities First Readers, as Councilmember Gutierrez talked about, and I mentioned briefly, is a program that's bringing together early literacy programs across sectors. So in healthcare, we have Reach Out and Read and Play Read VIP. We have community organizations like Link. We have childcare and early child education programs like Jumpstart. We have home visiting programs like Parent Child Plus. And across all of these, our goal is to increase engagement of families in early literacy programs and activities, and really increase the contact of each of our programs with families and the impact of those programs through complementary messaging across all of the settings where families are. And I think we can go to the next slide. Right. So we have 17 partners, and we do a number of things to get partners engaged through these different systems. We have community events where all of our partners come together. We have Literacy Month, where each of our partners are individually providing the same literacy kits and information for families. And then we do more individual partnerships where we can go a little more in depth. And the next slide. And so I want to focus on one of these, which was a really successful and ongoing partnership we have with the healthcare clinics, including Reach Out and Read and Play Read VIP, and our city libraries. So through this partnership, we have been able to sign families up for library cards in the pediatric clinics at several hospitals across New York City. And we also help them find their local library branches. We share information about story hours and other activities that are going on at those library branches, and other things that they can participate in. You can go to the next slide. And from our research, I'm a researcher, so I always like to share a little bit of data. From our research, we know that this has really worked to increase parent-child reading. So when families received both Reach Out and Read, they got books and their pediatricians talked with them about reading, and they also got library cards and went to the library. They read more often at home. They read a greater diversity of books at home, and they had higher quality reading interactions, including asking questions, pointing to words and pictures, and talking about the story. And all of those things relate back to the science of reading, things that I was talking about in the beginning. Next slide, please. But we know, especially, one of the really great things about this is that this impact has the potential to be much broader. So not just for early reading, but our libraries here in New York City offer really many services that the clinics can't address. So we have adult English and literacy classes, computer skill classes. They offer immigrant services and career services, including rentals of business, like interview style clothing for families who may not have it. And so when we build that trust and that partnership with pediatricians and the libraries through that early literacy as a starting point, we can help families take advantage of all of these resources and really broaden that partnership and that community engagement.
Wonderful. Thank you so much, Caitlin. I think we're going to stop sharing for a second. Libraries are like quilts. Libraries are so integral to our history as Americans. There is one in every community, in every neighborhood of New York City. They're also universal across New York City, whether we're talking about New York City public libraries or the Queens libraries, they're everywhere, and that's true across the country. So what a wonderful stitch, what a wonderful connection you've made for families into a different hub, right? Not only the health hub, but the library as a hub. It really is amazing to see all these connections made. And I wanted to go back a little bit because sometimes when you're sitting in your own clinic and you're like, how do I take that step forward? Like I have reach out and read, what do I do next, right? Where is that next stitch? Where is that next batting? Where is the next component that I'm going to pull together and build? So I want to go back and I'd love to turn to you, Amanda, and hear your story about how at Columbia and in your clinics, you were able to take both maternal health and child health and bring them together into a comprehensive system and really build that over time.
Absolutely. And I just want to echo that it's so wonderful to hear how all of us are working on very similar initiatives and aspects, and bringing your analogy and building our own quilts, that in our healthcare system, our ambulatory care network provides care to not only mothers, children, and adults, but is a resident-driven practice. Like, we have trainees that see the majority of our 0 to 5-year-olds, and we have this enormous community pediatrics portfolio of services that has grown over time as those have come before me have established these programs, much like what Marcy was sharing with us. But what our trainees and others have experienced is that sometimes it can be really overwhelming, just the myriad of services and programs that exist, and how families are introduced to those services and programs. And what we had noticed is that sometimes we're putting in referrals and our residents feel this frustration. I put in a referral and the patient comes back and they never heard from anybody, or they never connected, or there was confusion. So I think the goal of the entire maternal and childhood integrative mental health initiative was to take a step back, understand what is the patient's experience in navigating a large healthcare system, both from the mother's perspective in her obstetric care journey, and then from the child's perspective as they initiate care in pediatrics, to really understand where they're getting these touch points. And so it started with this healthcare journey mapping. And I think you can just click through. There's some touch points here, just different referrals that come through. But you can imagine that as a mother is going through her OB journey and getting screened for social determinants of health, that she gets a referral to social work, or she'll get a referral to lactation, or a referral to the community healthcare worker. And a long time in pediatrics, similar things are happening because we're identifying that same need in that same mother who's now coming to us in pediatrics. And that mother and child dyad is getting outreached by a multitude of people, so many different people offering similar but slightly different services, and getting phone calls all throughout the day. And so engaging in these services can be really overwhelming for a family. So the entire goal was to understand that and just put it all together, make an umbrella of service packages in a way that's more approachable for families, and to have everything funnel through one program, one intake, so that a family doesn't have to get 1 billion phone calls from a billion different people to help them navigate their journey. You can go to the next slide. You can, sorry, these are just, you just keep clicking through. These are just all the different referrals, examples of things that can come through that I just verbalized. You can see it's a lot. The whole point, it's a lot. And so it was understanding in this next slide, just what are the wraparound services that exist? What do we have already? What are the programs that we already work with? Ones that we've built internally, but also partnerships externally. And then what's missing, right? In our case, a lot of the mental health component, there were some services, but there needed to be more. Next slide. And so the workflow and process was, let's really understand this journey of the parent, really understand what they need, make new programs where they need to be made. We didn't have HealthySteps at the start of this, so we needed to bring HealthySteps in because we really felt like the mental health support in that early childhood period was missing for us. And then formalizing the community relationships a little bit more to create this early childhood collaborative, right? Like the support system that could exist. Next slide. And then most importantly was creating a centralized referral model so that if OB needed these services, if we needed these services, they're putting in the same referral to the same intake team so that that same team member, our MAC IMP team, can say, what have we already engaged this family with? What have we not? And what is actually their top need and priority right now? Because maybe we really want them to connect to behavioral health, but there's acute food insecurity that needs to be addressed first. And so we're going to work on that. And even though that's the clinician's best intent right now, we're going to make this the priority and give that service to the family. So we don't have to go through the nitty gritty, but that's basically the story, is just understanding where the patient is coming from and giving them the services in a more streamlined and centralized way. And the next slide just showing that instead of all of those other little arrows, it's one referral and from either behavioral health, OB, or pediatrics.
I think that's a beautiful story, Amanda, and I'm going to kill it with the quilt analogy again, because you took all these separate things and created a pattern, right? The families can't see the pattern from their perspective, and you had to go from the family's perspective to see how you could patch it together to actually work for them. Beforehand, people were just seeing themselves as individual squares, right? And that's a beautiful story of how you were able to shift the dynamic. The services are not for us as the providers, the services are for the family. So how can we get them to a point where they can access them thoroughly? That's beautiful. I love the mapping and I love the slides. So I want to go back to Marcy for her story, because I think we got that big overview of how she took Reach Out and Read in 2006. And by 2026, over 20 years with a lot of hard work, a lot of ground laying, and, you know, in a city hospital, really putting that together in a way that fits as well. But I think we alluded to a little bit that the success of the Reach Out and Read in the clinic setting was to some degree the baseline. So I want Marcy to share with us some of the Reach Out and Read implementation keys that were done at Queens Health and Hospital to allow that to succeed and then therefore lead to all these other initiatives. So take it away, Marcy.
Thanks, Liz. So part of sustaining and building a durable initiative and a program is really to sometimes sweat the details initially, so we can create that well-running machine and it can sort of self-sustain. The other thing when it comes to Reach Out and Read is you really have to have great people who are interested in this as well. And I have to call out someone who's probably on listening now is Dr. Catherine Ballora. She's our associate chief here in Queens, and she's been my partner in this, and she's kind of taken it and ran with it. So I have to mention her. But anyway, to begin with, we needed to establish a strong inventory and distribution strategy that was care team user friendly, but still ensured that we were being good stewards of the books that we were granted. So our older method, which is still not such a bad thing, but very manual, was that we color-coded all our books so that everybody, at a glance would know the age range for the books. We labeled all the, the shelves in the closets. We organized everything. And then we had these manual inventory sheets where the PCAs for each team would have to, record how much they took out of the closet. And it was, quite involved. And yeah, I mean, it worked for when it worked, and, it's not such a bad system. But more recently, as we've been able to have reports of our EPIC documentation, so which you'll see on a slide coming up, we've been able to dispense with a lot of the inventory sheets and really look at the data from our EPIC reports. Our staff is also much more familiar with being able to judge which book is which. We still try to color code when we can. We make sure we put them on the right shelves, but folks are really familiar, even if with a new book, in making those judgments. Next slide. So the second real important ingredient is staff engagement, besides having another champion to work with. We've done periodic in-house ROR in-service opportunities. I used to be an ROR instructor, so I used that and did in-house reminders. And then Catherine does the same during our departmental meetings. It's an all-level participation in our clinic. As with all of our initiatives and programs, everybody has some role in participating. So of course, we know what the pediatric providers do, but the nurses also, as part of their teach back and anticipatory guidance, will talk about reading to your child. Our patient care associates are involved with sort of the inventory system and resupplying our exam rooms, and our clinic manager has made sure that we have space allocation for books and supports for all of our initiatives. We ask that all of our staff complete the formal online ROR training so that they're up to date. They're all obviously all informed about new initiatives, our new BCB book program where we're rolling out books starting at birth. And then we have key hospital leadership involved, particularly around our book fairs, and they've been very supportive on making sure we have the space, and EVS cooperates and all those other things. So next slide. So our clinical documentation about an EPIC involves really 2 click boxes: that the book was given and that the modeling and counseling was delivered with the book. And we click those 2 boxes, and it creates obviously a discrete data report. And so now we are able to cross-match that with the eligible population visit data. And now central office, H&H central office, has been nice enough to actually run those reports for us and give us that feedback so we know what we're doing. And it's also the same reports we use to do our Q6 month ROR reports that have to be submitted. Next. So Reach Out and Read Alone is wonderful, but we've again built on some of that by having special programming around reading. We had some very interesting connections here in terms of authors. One of our hospital police, his wife is an author, and we connected with her, and she did a read aloud, and we purchased all of her books and we gave it out to everyone. It's in English and in Spanish, and it's just such a lovely, warm, wonderful book that everybody really connected with it. So we had that. One of our pediatric hematologists who since retired became a children's book author. It doesn't really serve the demographic of 0 to 5. It's more for early readers in grade school, but she wrote 2 wonderful books, and she did a read out loud in our clinic, and we gave out those books. And so whenever we have those kinds of opportunities, we want to enrich the whole reading to your child by giving out free books and having a real author present. Next. So a lot of, again, ROR adjacent initiatives. You've heard about the library connections, and we've taken advantage of that. We give out the library Little Learner library kits from the Queens Public Library at our 2-month visit. And then if some of you might be familiar with the Jaeger Foundation books, the Mommy Talks, Let's Talk, and Talk to Me books. We've been actually buying those, ordering those books they're free, which is amazing, for many, many years now. And we were originally giving those out in the 0 to 5 month period. And now, since we have the new building early readers program, we're going to be giving these books out in postpartum. And then last, of course, we do back to school events where we give out free coloring books. We partner with our managed care organizations, and they will supply some other supplies. Next. Fundraising, which I know everybody has to think about. Again, we used to have the Scholastic book fairs. Now we have the Billy book fairs, which work very, very well. We do it in our breezeway in our lobby. The entire hospital looks forward to this. It happens 4 to 5 times a year. So not only do our families get to buy, affordable books, and but our staff love this. They absolutely love this. And we have a percentage that gets deposited into our Scholastic and Barefoot Books vendor accounts, so we're able to just spend those down and supplement our purchases. We happen to be also a recipient of South Jamaica Reads, which supplements our core book allocation along with ROR. We always try to take advantage of sort of the fire sales that we hear about, that they're, there's books in a warehouse. Do you want them? We're there. We get our hospital van and driver to pick up the books. And then we have some individuals donating books, which we screen and we accept for the waiting area. So it's kind of like a all-out effort to make sure that we have supplies. And I think that's it. Yeah.
Fantastic. I love that, the resourcefulness, right? And really bringing in the community. The story where it was one of the police officers at the hospital, his wife is an author. Like, that's just so wonderful, making that community connection, because I assume they also live in the community or close by. So that's just a great way of building on what you have, right? And taking that next step. And I want to talk a little bit. I didn't talk about much about myself, but so I'm the executive director of Docs for Tots, and we oversee a program called Help Me Grow in Long Island, on Long Island, and there's 5 other Help Me Grows in New York State. And we heard Manuel Jimenez talk about New Jersey and how they've partnered with Help Me Grow there in some of their research. There are Help Me Grows in like 31 states and 130 different systems. They keep changing the number, so round up or down. I don't know what we're currently at. And that is another potential connection that we can have outside of our community if it exists, right? The other, and we can also learn from them, right? We can learn about what's going on in these other places. The other great part that we can learn from are actually the Transforming Pediatrics and Early Childhood. New York State was not an initial grantee, but there were 8 grantees across the country in Arkansas, Massachusetts, New Jersey, Oregon, California, Maryland, Oklahoma, and Vermont. They have really taken that next step with some federal funding to sort of build these things around. Many of them started again with Reach Out and Read and are building it. So we're not alone here in greater New York in doing this. This is happening across the country. And I think it's important to realize, one of the people that conceived and really built that TPEC hub was actually David Willis. And I have to be, pediatrician David Willis, and I have to be completely honest that I stole the quilt analogy from him. I actually heard from him first, but I do it much better than him. You can all tell him that later. Like, he just kept it small. I've really expanded it and, hit it over the head with a brick. So there's so many people doing this work, and we're not alone doing it, right? And we have to learn from each other and see what we're doing. The other group that's another great ally to have, if you're not connected to them, is our Learn the Signs Act Early ambassadors, from the CDC, talking about developmental milestones, using those books that were created by the CDC. And I think these 3 amazing panelists, these women that we have sitting here in front of us, has shown us the fortitude and creativeness that it takes to blend these things together, but that it is possible, and that we're all doing it across the United States and really helping our families in our communities, because it can't just be one size fits all. What's going to work in Queens is going to look different than what is going to even look in Washington Heights. So even within the city, it can't be the same plan. We have to have the flexibility, but also the evidence to show what the key parts of doing, and then what we can adapt to make fit our actual individual communities and health systems. So I think that is where I sit here. I sit here in amazement of the work that you guys have done. What I'd love to ask is the folks in the chat, the folks on the webinar and just listening in, you guys are doing this work too. We just pulled 3 wonderful examples out. If you guys could put one partnership into the chat, like, what's one thing that you're doing now, in addition to Reach Out and Read, that you're starting to build on? You've heard some examples from these people, and then if you put that into the chat, we'll be able to read some of those out. So what are you doing, whether it's, I don't want to give people ideas. Did we put everybody to sleep? There must be someone to put something in a chat. So a key partner that you're working with in your setting. PBS Kids, that's great. Healthy Steps, that's a common thread that we're hearing. And of course, New York State is yet again offering from their Office of Mental Health, has a new RFP out for anyone that's interested in starting up a new Healthy Steps. And we definitely have some advocacy around Healthy Steps at the state legislation of trying to change Medicaid billing to enhance rates for Healthy Steps. So that's something a lot of people here on the phone are involved with. Getting back to New York Public Library, so important. And also libraries and Help Me Grow in Minnesota. So again, some of these things are happening. Prescription for Play. None of us had mentioned that yet. That's so important. Vroom, that's another important one. We use Lantern, which is a text messaging system, and all their messages are based off of Vroom. If people aren't familiar with Vroom, yeah, reaching out to mental health organizations for mental health with new moms to make sure that our mental health organizations are adept and well trained to deal with that dyad. Amanda, you kind of alluded to that, right? So you can have mental health services, but are they equipped and ready to deal with the perinatal issues and treat mom and child together as that dyad? That's so important to build up.
Dr. Isakson, we have Jeanette Martinez in the raise her hand to speak if
Oh,
Jeanette
sure.
wants to come off mute.
Go ahead and come off mute. Oh, it was by mistake. I just saw that in the chat.
Oh,
Yeah, I apologize. I was just trying to put something in the chat and I accidentally raised my hand. Thank
Listen,
you.
we've been on the Zoom thing nonstop for 6 years since the pandemic, and I still can't always find the mute button, right? Like my dog's barking and I
Yeah.
can't find the mute button. I totally understand. Wonderful. First things first, diaper banks. Shout out to Heather from Long Island, one of my co-conspirators out on Long Island, and diaper need is real. And I know there's some really interesting work happening at Northwell and a couple different clinics in and around the city around distributing diapers. So really exciting stuff. Someone asked if it's being recorded. I have no idea. I'm going to leave that up to the powers that be. Yes, it is being recorded. Great. Don't ever show that recording to David Willis, all right? I didn't badmouth him. All right. As we move on and try to start to wrap up, I see that so many people in our audience are already doing this work, and I hope you found inspiration from our panelists and knowing what's going on across, and that we're all doing this work together. For those people in our audience, if they wanted to take steps that Amanda, Caitlin, Marcy, that you've been doing, what piece of advice do you have for them? What do you want to leave them with today? Why don't we start with Marcy?
Well, I think you heard from my narrative that you have to sort of be scrappy. You have to assess your resources, find new resources, sometimes bargain with people to get stuff done, which is, I'm not ashamed to have said I've done that. And I think when you do that, you inspire other people to do the same. You mentioned, prescription for play. One of our staff found the Lego prescription for play thing, and we're actually doing that also. So it's when you get people going, it's contagious, I think. At the beginning, there's like, wait, more things? You want more? And then afterwards, everyone's like, well, this is the standard of care. And when we have opportunities, we're going to take them because it absolutely makes things better. So yeah, that would be my advice, I think.
I love that. Scrappy, resourceful, and building on success. That's amazing. Amanda, what do you have to say? What's your words of wisdom for our audience here today?
So I'm a junior faculty member. I think it's really find the people that are like-minded, right? The work that I presented today is me being a small part of a very large team. Think about that thing that when you come home at the end of the day just doesn't sit right with you. For me, it was early intervention and how like challenging it was to get my families connected. And then just work on that one thing. Find the people who are interested in that one thing because there's a lot of work. We're all doing a lot of work that's being done. And as long as you find the people that are in the right like-minded space, it'll come.
So find your tribe, find your passion, and take the next step. Move the next step forward. That's great. Caitlin, how about you? What's your words of wisdom for our audience here today?
Yeah, I think it's really important to think outside the box when you're thinking about who you can partner with and who are the people who are doing this work and who, as Amanda said, are the like-minded people. So we've developed partnerships with everyone from dentistry in the clinics to, childcare and early child education, which, we've actually built on that and recently adapted Play Read VIP to work with childcare providers rather than parents. And of course, partner with researchers because we love to do this work and really think about building the evidence base for these programs, which is really, I think, important for advocating then for policies and, funding to support them. And I think the importance of doing this and thinking about all of these different partners is that, all of these new perspectives bring different ideas for how to approach a problem and also how to look for funding, which we all know is so important. And so, together, right, we can think about how to get families those resources that they need.
Yeah, very true. We didn't talk a lot about funding, but that's also sometimes the scrappiness, right? And the partnerships, and that's how the funding comes. And I don't want to miss the point about study. Because if you don't study it, you're not going to build on your successes. Even if that studying is very just a quality improvement data, right? That it made this small amount of difference for the small N. Yes, you want to work with people like Caitlin so that you can publish it, but you also want just that level of input, of focus groups, of family feedback, of success at the clinic that might never be publishable, but will make a difference if you're applying for funding that will tell a story about how this was successful in your place. So really, the study can be on two levels. It can be capital S NIH funding, woohoo, and it can be, quality improvement, small s. Are we making a difference? Are we doing right by our community and our families? So I think it's both levels. Go ahead,
And
Caitlin.
I'll just put in, I'm just going to put another plug for that for working with researchers. We often know about like little pilot project grants, internal and external, that can help with even those small quality improvement projects. And so partnering with researchers, is really important, as you said, Liz, for getting that evidence and building then to be able to go to people and say, yeah, this works. We know it works. Now we want to take the next step.
Awesome. Wonderful. So that actually concludes our formal set of questions that we had for our panel. So I'm wondering if we might want to open it up to the audience and see if they have any questions or comments to hear back. Come on, you can't be that quiet, folks. Well, while our audience is getting their thoughts together. Oh, here we go. There's a question about how do we sustain partnerships long term, right? Especially when there's staff turnovers. And certainly in the past 5 years, we've had a lot of staffing turnovers and different things. Any words of wisdom from our panelists about sustaining partnerships?
I can jump in first. I think it's about bi-directional relationships and making sure that you're giving as much to your partner as you're receiving from them. And not every partnership is going to work, but for the ones that do, really put your time and energy into it. And I'll let others comment.
Yeah, I love that idea. I think one of the other things about partnerships is don't let your own vision of what a partnership is limit what it is. We do a lot of partnerships on Long Island, and some people I need to talk to on a regular basis. Like I need to sustain that partnership, I need to be having a conversation with them every quarter. There are other partnerships that I know I can just send a random email at 2 o'clock in the morning once a year, and I hear back from that partner and I get what I need. So partnerships can look very different individual to individual, and sort of accepting them all for what kind of partnership they all is really important as you start to build and understanding each other. Caitlin, I saw you come off.
Yeah, I was just going to build on that that same idea. I think also understanding each partner's capacity and working within that. I think one thing that's been really successful for C's First Readers is that we've sort of had an equal focus on building each individual partner's capacity, and at the same time working together for those partnerships and those, you know, organized community linked events and other things. And so we're never asking any partner to do something beyond what they have, you know, staffing or funding to do. And I think that understanding that and being aware of it throughout the partnership is really important.
Yeah, absolutely. Someone said that scrappy needs to be today's word. I completely agree. That should be the word of the day. Wonder if we want to talk a little bit about, we've talked about building partnerships and sort of maintaining those. How about building trust with families and who might feel disconnected from the healthcare system, or hesitant to engage in community resources? Have you developed any strategies for that, or how have you dealt with that?
I'll jump in about Queens. We've been blessed to have community health workers who've really played an important role. We were very intentional when we were doing the hiring to make sure it reflected our community, languages, culture, and so forth. And we hit most marks in that respect. And I think that made a very big difference in, you know, the way our families engage with the community beyond Queens and beyond the hospital, beyond the practice. And so, yeah, I mean, it's not always easy to make that happen as a clinical provider. Everybody, again, we've already gone through, you know, the laundry list of things that have to happen, and the social workers really are up to here with, you know, the really high level stuff that they have to do. So the community health workers have really been an amazing addition to our clinic workflows, and in terms of connecting patients to services both within the hospital and the community, and really being their advocates. I mean, and their voices in many situations. We have some really talented folks. So again, not everyone has that luxury. So, you know, I can't really speak to, you know, getting over that challenge, because these families have so many challenges now. And again, having community health workers has really made all the difference for us.
Wonderful. We have a great comment from Gabriella in Florida. In Florida, we always say relationships matter, from the community partnerships to our clinical work with receptionists, medical assistants, residents, and pediatricians. It's important to make those connections face to face to understand what the clinic and the community needs. Yeah, definitely. It's building those long-term relationships.
I want to, in the moment of pause, I want to just give an example with us in terms of building relationships. We have two pediatricians, two pediatric specialists. One was born at our hospital, who's now one of our specialists, and another got her health care as a teen at our hospital. Ours as tween and teen, is now one of our specialists. So in terms of building relationships, that's one example. And the other example is one of our pediatricians here is now finishing her 54th year as an attending year, 5-4, continuously as an attending. She's taking care of the grandchildren of patients that she started with when she started her practice. So in terms of building relationships, the power of those relationships really makes every bit of difference. And I think about health outcomes. Those families, you know, feel secure, you know, they trust the individuals and the care that they're getting here. So very important.
Indeed. And I think that actually is a wonderful note to end on. Then I want to just say thank you so much to Amanda, Marcy, and Caitlin for sharing their expertise, their experience, with their humbleness, right? And sort of what the real challenges are um, and how we move forward from here. Maybe we have time for one more question. I'm waiting for the powers to be to tell me, because we just had one come in at the very end with how can we encourage residents to incorporate reach out and read into their continuity when it comes to their continuity clinics right after the noon lecture. Most of them are tired and do not feel motivated to grab a book from our bookshelf, which is on their way to clinic. Amanda, I'm wondering if, I know you do a lot of work with residents. Can you take that one away?
Absolutely, and we're currently doing a QI project to improve our distribution and rates for our 0 to 6 month olds in our continuity clinic practice. I think there's so many factors. Building the education about reach out and read into the curriculum is key as opposed to being an add-on. Secondary is if you can move the books into the physical space, like residents, they have so much to do and they're moving from an inpatient service or from somewhere else into the continuity space, that anything you can do to physically make the proximity of the books closer makes a huge difference. Ours are in the exam room, and now we have data to show that our clinics that don't have them in the exam room versus ones that do, it makes a remarkable difference, and making it easy for them to identify age-appropriate books and sort. I mean, this could be a whole other session, but hearing what the residents, like, ask your residents what would make it easier, get some input from them, build it into the curriculum, make it easier to access. I'll stop there.
All right, fantastic. And I think that really blends on what Marcy was saying, like how you set it up in the clinic matters, right? Like what your procedures are, and you can have big dreams, but if your procedures aren't right on the ground, it's not gonna work. It's a both and. So fantastic. I am going to hand it back to our Reach Out and Read folks and let them take it away. Thanks again to Amanda, Caitlin, and Marcy for sharing your wisdom and your experiences.